Detectives, innovators, counselors, advocates, and humanitarians, you're invited to meet the medical doctors of the OC Healthcare Agency.
My name is Zahn. I am the medical director for Epidemiology and Assessment for the Orange County Healthcare Agency. I've been here for 4.5 years. Previous to this, I was with the Louisville Metro Department of Public Health and Wellness as their medical director. Epidemiology is the study of rates of both health and disease in specific populations. And so those populations can vary. So if you have an outbreak of foodborne illness in a school, one school population, or you can have a cluster of tuberculosis in one neighborhood population. And then on a broader scale, you can think about the rates of influenza illness, for example, in one ethnic community in Orange County. So at a base level, it's what are the rates of disease. But then epidemiology also strives for, and what we look to do is identify what are those causes for those differences in rates, and what are the effects that those diseases have on those populations. You realize you have the combination of working with science and information that you really enjoy from an academic standpoint, but then it's also the chance to help to help people. And there is nothing that is quite so enervating as I work as a pediatric infectious disease physician, and I get to do some clinical time at the Children's Hospital of Orange County, and there is nothing that is as emotionally satisfying as the connection you have with a family when you help a child get better. So that's what got me into medicine. I think that what has made me interested in public health and epidemiology is you recognize when you are a doctor seeing patients that there's an awful lot that goes on outside the four walls of that clinic patient exam room that affects people's health. You know, you can come up with the most wonderful medical plan in the world for care for someone, but if you don't address what's going on with them in their home, in their community, then you're not getting there. And working in public health allows you to do that. What you have to love about public health is you can form an attachment to your community. You can learn about your community and what's important and special about each place. You know, Orange County, I think on a national level, probably has certain stereotypes, but I think any of us who live here realize that Anaheim is different than Newport Beach, and Newport Beach is different than Santa Ana, and Santa Ana is different than San Clemente. All of these communities have important differences culturally, socially, and so learning what makes those communities tick and how we can make public health work within those communities, that's what's great about public health. That's what inspires me each day. You know, we have a community of 3 million people. That's basically the size of a state. And I have 5 epidemiologists and 5 nurses working in our program, and they get a tremendous amount of work done with those resources, with the resources they have at hand. And I think people very often are surprised to realize how much work they do responding to measles outbreaks or responding to all the West Nile cases we've had the last few years. The reason they're able to do it really well is they partner so well with our partners in the community, with medical providers, with hospitals, with private industry, with the school systems. You know, they just do a huge amount of work of making those connections. I think that's, you know, the amount of work they get done with those resources, I think is impressive. What you hear about is not necessarily what you see. I think that people hear about, last year you heard about Ebola, and this year you hear about Zika. And, well, it's not that we don't see any Zika disease, but day in and day out, for the last several months, influenza, for example. You know, I think people have flu fatigue. It's here every year, and so it's hard to get newly excited about it maybe every year. But diseases like influenza that are vaccine preventable, that is what we see coming through the door each time of year. People hear it so much that you begin to hear it as white noise, but the truth is that hand washing on a consistent basis is really one of the biggest ways you can make yourself safe. Hand washing, washing your hands. If you are taking care of someone who is sick, of a loved one who's sick, to keep yourself from getting sick in the first place. And if you are ill, making sure you're washing your hands consistently so that you're not passing germs on to other people, no doubt. I think the other big thing that I think people forget about is that if you are ill, and none of us want to say, well, you know, I've just got a cold, or I feel like I have flu-like symptoms, so I got to stay home from school or from work. But if you go to school and you go to work, there really is the potential that you're going to expose other people. So I think people should be aware and keep in mind, if you're feeling sick, sometimes you're doing your coworkers or people around you a service, staying home, taking care of yourself, and making sure you're getting better before you're going back.